Earlier today, I talked about quality of life with the nurses. And what I really enjoyed about this session is, one, the enthusiasm that people really want to understand quality of life. For us as a Lymphoma Coalition, we collect data through a global patient survey that we do every 2 years on patient experience. Plus, in 2022, we did a series of qualitative interviews with patients and caregivers who have been treated with CAR-T. From that, we could highlight the main physical issue that patients say is impacting their well-being is fatigue. And that's a huge unmet need in many ways. One, for patients in being able to describe it properly and the impact that it's having on their life to their physician so that they can act. Two, then when you're talking about that to the healthcare professionals, that they actually give you some good, credible support so that patients feel like that their complaint is really being recognized and addressed. And then three, the follow-up, because even if patients do talk about their fatigue with their doctor, it's not often followed up with at later appointments, and so patients wonder if they're really being taken seriously. Yet, it's still impacting their life in a considerable way for a long period of time. And then the other issue definitely that we see is fear. Patients are fearful of their disease coming back, they're fearful of dying, they're fearful of their lymphoma progressing, and that is definitely, again, something that needs more attention. Sometimes just more information on the status of their disease and their outcomes would be helpful. Other times patients do need additional support. One thing we do like to point out is really just encouraging patients to talk about some of these issues. Not all of the issues that are having the largest impact on a patient's quality of life are actually those things that physicians or nurses may consider the most medically important, right? It's not necessarily the severest side effects or issues with how product is being administered or any of those things. So it's like, how do you actually figure out what are the biggest issues for a patient? And that requires a different level of conversation than would normally happen in clinic. So we do encourage everybody to rethink about how they're asking patients questions. Ask them, like, what's the biggest thing bothering you right now? And let them answer to an open-ended question without any kind of positioning about where the topic should be, and let them just really focus in on what is the most important thing to them. I think everybody will learn more if we do that, more of that kind of questioning. Also from the patients, maybe they'll learn to open up more. It is quite difficult for them sometimes to raise things that they think maybe the doctor is not that interested in or is not really a good topic to be talking about with the doctor. But if it's really impacting their quality of life, then it is important for the doctor to know. One other thing that we did see with anxiety and depression specifically, when we did the survey in 2020 and then again in 2022, we asked about the difference between the intensity of the depression and anxiety and if that had changed due to COVID. And what we saw is almost 70% of patients with anxiety said it was worse during COVID, and then 60% of those with depression said the same thing. Now, just because the trigger, which may have been COVID, has gone away, does not mean that the anxiety or depression has resolved. Mental health doesn't work like that. So oftentimes patients will need more support. We'll do more qualification of that in the 2024 Global Patient Survey to see if that's been easing or if we just need to increase psychosocial support overall for our patients. The other thing we noticed when we looked at a lot of the barriers that patients face getting treatment, again, the difference between the 2020 Global Patient Survey and 2022. In 2022, almost 70% of patients indicated they were experiencing barriers to care. They may be financial, transport to their treatment centers, they may be a wealth of things. There's a lot of different kinds of barriers patients are dealing with. But in 2020, only 30% of patients said they had a barrier. So that rapid increase from 30% to 70% is massive. And yes, some of those things can be attributed to some of the difficulties we saw during COVID. But we'll have to see in this next survey if those are resolving or some of the issues that have come to light with healthcare systems in general over the last years persist, and patients are still dealing with a lot of difficulties actually getting the treatment that they need.